Welcome to the virtual preoperative education seminar for colorectal surgery. My name is Jen Stein. I'm one of the patient navigators here at St. Barnabas Medical Center. I've been working with surgical patients for the last 10 years. My background is clinical nutrition. I'm passionate about using nutrition to help our patients feel better and recover faster after surgery. We're going to go over today what to expect in the hospital when you come in for your surgery. We hope this information is helpful to you and your families. Welcome to the Comprehensive Enhanced Recovery Pathway. This is the pre-education seminar for colorectal surgery. This is what we hope to cover today in the seminar. What is comprehensive recovery after surgery, or CRP? How to prepare for surgery, what to expect after surgery, staying active after your surgery, and recognizing and preventing complications. Welcome to the pathway, the Comprehensive Recovery After Surgery Pathway we call CRP. It is a care plan prepared for you by St. Barnabas Medical Center Surgery and the anesthesiology teams. The clinical pathway helps you prepare for surgery, recover safely and faster, and return home as soon as possible after surgery. Our team consists of nurses, physicians, dietitians, anesthesiologists, and many others. Why do we use the CRP pathway? It's going to help keep your hospital stay short. It's going to keep your pain level under control. It will help you get out of bed and walk faster. It will allow you to eat and drink as soon as possible, and also help us listen to your concerns. We want to make sure you're happy with your care. So what to expect before surgery? The first thing you're going to need to do is get some pre-admission testing to make sure that your body is ready for surgery. In some cases, pre-admission testing can be done at your primary care physician's office. However, most patients will be having testing done at St. Barnabas Medical Center and our pre-admission testing unit. During pre-admission testing, most likely be taking some blood work. In some cases, we might need to do a chest x-ray. We'll also do EKG of your heart. And in these times, we're going to be doing a COVID test. The timing of the COVID test will change, but our unit will let you know when they schedule your pre-admission testing appointment. What will happen in pre-admission testing? This screening most likely will take place over the phone with one of our nurse practitioners. They will review your medical history and physical, your surgical history, any allergies to medications or any reactions, and they'll also review your medications, supplements, and vitamins. Our preoperative team will take all measures to make sure that you are screened safely. We'll use telehealth when possible, and we'll limit your contact and time in the hospital. Our patient navigator is available for an education session to talk about what to expect during your hospital stay, how to prepare for surgery, and discharge information. We can do the session over the phone if you're more comfortable with that. You will receive a patient guidebook for surgery. These comprehensive recovery pathway guidebooks are specifically for lower intestinal surgery or colorectal surgery. The navigator will give you a readiness bag with 2 preoperative carb-loading drinks, a chlorhexidine cleaning wash or CHG wash, and an incentive spirometer. What is a preoperative carb-loading drink? It is a drink that we'd like you to drink the night before surgery, and we'd like you to drink one 2 hours before your surgery time as well on the day of your surgery. We get a lot of questions of why we do a carb-loading drink. Maybe you've had surgeries in the past and you never had a carb-loading drink. The old way of fasting before surgery is no longer done. We encourage consumption of the carb-loading drink to help decrease your need for IV fluids during your surgery. If you have the first surgery of the morning, typically that's around 7:30 a.m., just drink 1 drink the night before surgery. Don't worry about getting up early in the morning and drinking that second drink. How about the CHG cleansing wash? We use this body wash to prevent surgical site infections. You'll use the soap in the shower the night before surgery and the morning of surgery. You'll receive 1 bottle. We want you to use half the bottle at the night before and half the bottle the morning of surgery. After you shower, please wear freshly laundered clothes after washing, and please sleep in freshly laundered sheets. We want to use the body wash from your neck down on your abdominal area. We want to avoid using it on your face, hair, or open skin. This is a picture of an incentive spirometer. We use the incentive spirometer after surgery to help clear your lungs, help you feel better, and to help prevent pneumonia. We're going to want you to take 10 breaths an hour while you're in the hospital, while you're awake. You should bring the incentive spirometer that your patient navigator gave you to the hospital with you on the day of surgery. A word about smoking and respiratory care. As far as smoking is concerned, St. Barnabas Medical Center is a non-smoking campus. Smoking will drastically impact your recovery after surgery. We can offer nicotine replacement while at the medical center, and we have programs in your guidebook that can help you quit before surgery. Pain management. Our preoperative team will meet with you before your surgery to evaluate you and your medical history, ask you about your current medications, assess and evaluate risks for postoperative pain, and to prescribe our multimodal pain medication. Our multimodal pain medication consists of taking medications the night before surgery and the morning of. Our nurse practitioner will go over your medical history with you and prescribe the appropriate medications. Typically, the medications are Tylenol and Lyrica the night before surgery, and then the morning of surgery, you can have Tylenol, Lyrica, and Celebrex. The idea behind this is that each of these medications works fine by themselves. Tylenol's fine, Lyrica is fine, but synergistically, they work together to help maintain your pain after surgery. In addition, we might prescribe a scopolamine patch to put behind your right ear. That's to help with anti-nauseousness after surgery. What are the goals of pain management? We want to help you achieve your therapeutic comfort goal. Our options for pain medication are the medications I just described, as well as interventional procedures. One of the procedures we do is called a TAP block. It is a nerve block that is done in the recovery room after your surgery. I'll describe that later. Additionally, pain management therapies that we can use are relaxation techniques, music therapy, prayer, meditation, and guided imagery. A word about medication instructions. Speak with your physician or surgeon about stopping medications that may increase your bleeding 7 to 10 days before surgery. Those medications typically are aspirin, anti-inflammatory medications, and blood thinners. Be sure to review your supplements with your surgeon as well, as those may affect your bleeding. It's usually okay to take Tylenol, but please check with your surgeon. Anticoagulants or blood thinners. Check with your surgeon regarding medications for blood pressure, heart, thyroid, and diabetes. The day before surgery, you will be allowed to eat solid foods up to 6 hours before your surgery time. Keeping our patients in a fasting state before surgery does not promote healing after surgery. So we will allow you to eat solid food up to 6 hours before your surgery time. As far as drinking, you'll be on clear liquids up to 2 hours before your procedure. This will help you stay hydrated, and it will quicken your return to normal bowel function, especially after colorectal surgery. I get a lot of questions about what are clear liquids. I say clear liquids are anything you can see through. So chicken broth, vegetable broth, beef broth, even sugar-free Jell-O is fine. Just stay away from the red flavorings. Tea is fine. Those are all good clear liquids to help you stay hydrated. In addition, your Ensure pre-surgery drink is considered on the clear liquid diet as well. So make sure you take that before bedtime. The day before surgery, you will receive a call from our surgery center call center, and they will tell you what time and location of your surgery. If you do not receive a call, please call 973-322-5130, and ask to speak to the call nurse. Just to review, on the day of surgery, you'll drink 1 bottle of Ensure pre-surgery drink. If you don't have that first surgery of the morning, the timing of the Ensure pre-surgery drink is typically 2 hours before surgery time. Please double check with your surgeon to make sure. Some surgeons want you to drink the surgery drink 4 hours before surgery time. We'll review that with you the day before surgery. You'll report to the registration desk on the ground floor of the Cooperman Family Pavilion. Typically, it will be 2 hours before your procedure. You will read and sign the registration forms and receive an ID bracelet. Preparation for surgery. The registration desk will guide you to the first floor for our surgery welcome desk. After you report to the welcome desk at the surgery center, they will direct you to the surgery center and give you a gown and instruct you on how to prepare your body for surgery. IVs will be started and you will sign a consent form. What should you bring to the hospital? Loose-fitting clothes, shorts, sweats, bathrobe, etc. Footwear, we want you to bring sturdy footwear so you can walk around the hospital. Personal toiletries are fine. Chewing gum or hard candy. I usually get a lot of laughs when I tell people they need to bring chewing gum to the hospital. We encourage you to chew gum 20 minutes, 3 times a day after your surgery to get your bowel function returning. If you don't bring it, that's perfectly fine. We have chewing gum on the unit. Don't forget your cell phone and charger. Please leave valuables, jewelry, and cash at home. If you have a living will or advance directive, please bring that with you. Bringing a list of all your medications is very helpful. Please make sure to include the frequency and the last dose that you took. After surgery, when you're in the recovery room, we call it the PACU, post-anesthesia care unit. That's when you'll receive that intervention procedure we talked about, the TAP block. It is a nerve block. The anesthesiologist will use ultrasound to find the nerve in your abdominal area that sends this pain signal to the brain. They will give you an injection to alleviate the pain. From our past experience, we found that our patients were allowed to use this, be pain-free, for about 12 to 18 hours. And again, it's done in the recovery room after surgery. Pain, please address it now. Communicate with your nurse and doctor is the key to managing your pain. Describing your pain location is very helpful as well. For example, describing gas pain is different than describing incisional pain. We strive to limit the use of opioids at St. Barnabas Medical Center. We have found that around-the-clock Tylenol has been helping our patients after surgery. After surgery, we want to encourage an active recovery. We would like you to get up and out of bed approximately 3 hours after your surgery time. Use your incentive spirometer for those deep breathing exercises. While you're sitting in your chair beside your bed, you may do ankle pumps to help get your blood flow going. And of course, we talked about walking and chewing gum to help with your bowel function. We also encourage you to take a shower. As you can see from this slide, immediately following surgery, approximately 3 hours after your surgery, after you've had your TAP block, we will get you out of bed for at least 30 minutes. Day 1 after your surgery, we want you out of bed for 3 hours, walking with assistance 3 times a day after each meal. Day 2 until discharge, we'd like to encourage you to be out of bed for 4 hours during the day and walk with assistance again 3 times after your meal, 3 times a day after your meal. What about feeding? We want you to immediately following surgery, we will give you some ice chips and progress you to our clear liquid diet. As soon as you're tolerating your clear liquid diet, we will progress you to post-op clears. Possibly provide a protein supplement to help start your healing. As soon as you're tolerating your post-op clears, we're going to progress you to a solid food as soon as possible. One of our inpatient dietitians will be available to assess how you're progressing your diet. Typically, our patients having colorectal surgery will be on a low residue diet while they're in the hospital. Discharge day. What is our discharge criteria? When can I go home? We want to make sure your pain is well controlled to an acceptable level. We want to make sure that you're urinating without any difficulty. And in the case of colorectal surgery, we want to make sure that you're passing gas or have a stool. You're walking independently, and of course, tolerating your diet. Discharge instructions will be done with the nurse individually at the bedside. Discharge plans. We want all our patients to be discharged to home. Please have someone available to drive you home from the hospital, and have someone who can help you at home for the first few days after surgery. If you're being sent home with a prescription, we will strive to fill your prescriptions while in the hospital with our inpatient pharmacy and have them delivered to your bedside. When you get home, we encourage an active recovery. Don't sleep too much during the day. Keep walking after surgery. No heavy lifting. The restrictions will go over with you. The nurse will go over with you. And we want you to continue with your nutrition supplements so you can continue to heal. One more thing, we want to make sure that you schedule a follow-up appointment with your surgeon before you leave the hospital. That will typically be done about a week after your surgery. Next, we'd like to go over some potential post-operative complications. After any surgery, there's always a risk that you could have these potential complications: blood clots, surgical site infection, ileus, pneumonia, and pulmonary embolism. Blood clots. What are the signs and symptoms that you may have a blood clot? You might have swelling in your calf, thigh, or ankle that does not go away when you elevate your legs. You may have pain or tenderness in your calf, and it can be in either leg. What do we do to prevent blood clots? When you're in the hospital, you'll have flotrons on your legs while you're in the bed. Flotrons are strapped around your lower legs, and they pump air to keep your blood flow going while you're laying down. And we always encourage activity, walking around the nurse's station, ankle pumps when you're sitting in your chair beside your bed, and of course the early ambulation or walking. We also use blood thinners such as Lovenox and aspirin to help with blood clots. Infection, surgical site infection. What are the signs and symptoms of an infection? Your incision will be red. You might have painful joint pain. You might have swollen joints, drainage at the incision, and temperature above 101 degrees. How do we prevent? Follow the CHG prep we gave you preoperatively. That will help cut down on the surgical site infections. Keep your incision clean and consume a high protein diet at home. That will help you continue to heal on the inside and the outside. Protein is one of the only nutrients that can help your body heal, so that's why we prescribe a high protein diet when you get home, and we give you the protein supplements when you're in the hospital. What is an ileus after bowel surgery? An ileus is a reduction in the gastrointestinal tract motility. In other words, a lack of movement in the bowel. We want to prevent this. This will make you feel full and constipated, and it could be problematic down the road. What are the signs and symptoms of an ileus? Stomach pain, bloating, constipation, feeling of fullness, and loss of appetite. How do we prevent an ileus? Fluids will help prevent the dehydration. That preoperative drink we do will help as well. Keep moving and walking, and non-constipating pain medications. Most opioids can have a constipating effect on you, so we try to manage your pain with that multimodal pain medication as well as around-the-clock Tylenol. Pneumonia. Signs and symptoms of pneumonia: cough, fever, shortness of breath, and painful breathing. How do we prevent that? The incentive spirometer, deep breathing, keep moving. What is a pulmonary embolism? It's a blockage in your lungs, usually by a blood clot that has moved from elsewhere in the body. What are the signs and symptoms of a pulmonary embolism? Sudden chest pain, difficulty or rapid breathing, shortness of breath, sweating, confusion. Immediately call 911. How do we prevent a pulmonary embolism? We use the same prevention measures as we do with blood clots. We use flotrons in the hospital, we encourage early activity, early ambulation, and we use medications such as Lovenox and aspirin. When will you hear from us? After discharge, you'll schedule an office visit with your surgeon, and you'll receive a phone call from our nurses. Thank you for viewing this video. Follow-up questions can be directed to me, Jen Stein. My direct number here at St. Barnabas, 973-322-9845. Be well.